All right, I believe now we are live.
Okay.
So, since we had a little difficulty. Yeah. So, well, sorry for the little technical difficulty earlier.
No worries.
Good afternoon. This is American Surgery Center. My name is Kemal, Erkan, our Bariatric Friday weekly event. I'm here with Dr. Isaias Irgau. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Again, I'm very happy to be here on our yet another session of Bariatric Friday.
This is this is the only way that I feel better after my 2 p.m. episode. So thank you for being available.
Of course, of course.
So as you know, last week we started a new journey with 3 of our patients.
Yeah.
The names are not real, but the people are real. So we are gonna every week we are gonna discuss what they are going through, what they're expecting from the surgery, how we can actually help them long term. And then this week we are gonna discuss maintaining weight after bariatric surgery. Now, although it's a little bit early on for them to know this information, but it's important for them to know why, what they have to do, because they need to make long-term adjustments in their lives, important adjustments, and sometimes it takes time. So now, Dr. Irgau, if you can just briefly introduce the program, and then I'm going to actually reintroduce our patients, and then we can start the discussion after that.
Absolutely. Absolutely. Thank you, Kemal. Hello, everybody. Again, I'm Dr. Irgau. I am the president of CHRIAS, or Christiana Institute of Advanced Surgery. My specialty is bariatric surgery or weight loss surgery. And weight loss surgery is the most effective treatment we have right now for morbid obesity, which is obesity that has become extreme, that has become connected now with serious illnesses like diabetes, high blood pressure, sleep apnea, and so forth. Currently, with bariatric surgery, we are able not only to help people lose extensive amount of weight, but also really liberate them from these illnesses. It's a treatment that is now recommended by most doctors for people who have a body mass index greater than 40 or who are about 100 pounds higher than their ideal body weight. It's important to understand that when we say body mass index of 40, that's a guideline. Sometimes even a body mass index as low as 35 can make a person a candidate for weight loss surgery if they have already developed illnesses related to obesity, such as diabetes, high blood pressure, or sleep apnea. At CHRIAS, we have performed thousands of bariatric surgeries successfully. In fact, we've been performing this, as I said, for about 20 years. And in our area, we are by far the most experienced group when it comes to bariatric surgery.
Thank you, Dr. Irgau. When you say it's the most effective way of fighting morbid obesity, what we also know is that this is only utilized by 1% of those who have morbid obesity, and still very little what people do, and if they whether or not they take advantage of what's available to them. And that's kind of like, I mean, in my opinion, it's kind of sad, but the way that we are able to reach out to people with these weekly events, at least we can actually make more, we can reach out to more people, and hopefully we can make impact on others' lives and their decisions for long-term fighting morbid obesity. This is one of those diseases that you have to talk to people and then make them understand this is actually a disease. It's not a life choice. It's not a lifestyle choice. So, and we fight with that every day. We deal with that every day. Important. It's extremely important to actually understand the patient population, and why we have this program in place. Why it's not just like one surgeon visit and then 2 weeks later you have the surgery done. It's a multidisciplinary approach. Different specialties are part of it.
Yep.
We work with them with our care coordination team. They are part of the process that they are going through, including myself with our other members of the care coordination team.
Yep.
So because patients are, I do feel, what happened today, Dr. Irgau, I didn't tell you this yet, but earlier I was getting this call from my direct extension, and I said, usually, most people in my business, they call me on my cell phone. So, and then because it's a local number, and it was more than once, it kept calling. And then third time I picked it up, and it was one of our patients.
Okay.
So while she couldn't make, the nice thing about what we do is she didn't realize that she was calling me.
Okay.
So, because my direct extension's on the disclaimer, in case if there's any data breach. So she was asking for an appointment. I said, well, you want to have an appointment with me? And then she realized that she was not calling the office. But then, because we do our case conferences, I knew that it was one of our patients. I said, okay, so are you calling for one of our practices? And she said, sure, and it's the CHRIAS. And then immediately we were able to just see what she needed, why she was calling. She missed her appointment yesterday.
Okay.
Well, she had a transportation problem.
Yep.
And she couldn't communicate right away. And then she was kind of like, she felt, I guess, guilty because she didn't let us know. And then any of those things are so easy to turn these patients off in a way that we can lose them in the process.
Yes.
So, well, I'm kind of bragging about me answering my office phone line. That's on the record. So that's one. But I think what's important is really understanding the patient population that we deal with and how vulnerable they are in a way that they are shy in some cases, and then they know that they feel. I believe that they feel like they are being other people. They believe that other people are judging them. Yeah. In a way. So. But I was happy that I was able to talk to her and then refer her back to the office, and she's back on the schedule. Now, Dr. Irgau, we have, let's just remember our patients since it's the second week, not everyone may remember them. We have Denise. Denise is 32 years old with BMI 43. After our appointments, she actually got she decided to go with the sleeve. Yep. She came to our office for gastric band initially. And then we have Patrick. Patrick is a 30-year-old with BMI 50. He's still a little bit undecided, but most likely we are going to go with gastric sleeve. Yep. And he has a problem with his TSH. And our third patient is Karen. And then Karen is a 52-year-old with BMI 41. Initially, she came to us with sleeve, but now she followed our advice, and then she's going to go with bypass because she has heartburn and also she has diabetes. Her A1C is 11. Yep. And we are working with these three individuals. So what we would like to know, and then we can start with Karen, again with the BMI 41, and what is how these three individuals, how are they going to actually maintain weight loss, that immediate weight loss that they will have in the 3 to 6 months time frame, and how can they actually maintain that long term?
Absolutely. So all Denise, Patrick, and Karen are going to have weight loss surgery. This very important treatment that will help them lose the weight, right? And also it will help them reduce the medical problems that they currently suffer from, okay? This issue about weight maintenance, as you said, is something actually that we discuss early in our consultation, okay? This is an important question for them. They have been through this road before, probably many times, where they've done a diet, a program, they've lost weight, the weight has come back even more, right? So they want to understand whether they are going to regain weight, whether they will struggle to lose enough weight. And the clear answer is that, yes, it's possible for them to regain weight. Yes, it's possible for them not to lose enough weight if they are not careful. a very famous bariatric surgeon from Princeton, who's, I think, retired now, Dr. Brolin. I remember in one of the earliest meetings we had for the bariatric surgery meeting, he used to say that anyone can out-eat any surgery. In other words, if a person is determined, they can defeat any type of bariatric surgery, whether it's gastric sleeve or the gastric bypass, right? So it means that the biology that is driving the weight gain, that biology is still there. What we're doing with surgery is we're providing an extremely powerful tool. So when people come to us and say, I've tried this diet, I've tried this, I've tried to control my eating, I've tried to be active, and yet I'm not losing weight, what we tell them is keep on doing that. Keep on being careful about what you eat. Keep on staying active physically. We are going to give you a powerful tool that will give you results with those things. We're not telling them stop eating in a healthy way, stop being active, the surgery will do everything for you. We're telling them we're going to provide a tool, an extremely powerful tool that will break that cycle that you were trapped in year after year when you were trying to lose weight by yourself, right? So this is an important concept. Patients ask me all the time, oh, will my stomach stretch? Is that how I'm going to regain weight? Well, in reality, if we take in the case of Denise or Patrick, when we do the sleeve gastrectomy, Kemal, we are reshaping the stomach. We're making the stomach a lot smaller. We're taking away about 80% of the stomach. So physically, that stomach can never go back to the size of their original stomach. That's not going to happen. But what could happen is that the small stomach that they have can become compliant, giving over time, right? And I explain that to patients by saying that one of the very important things that you need to learn is to be mindful when you eat and to try to understand when you feel full, right? Right? And if you start if you don't stop when you're full, and if you try to take another bite, maybe that extra bite will hurt you at the beginning because the stomach is small. But if you keep on doing that day in and day out, eventually it will not hurt anymore because that stomach will start accommodating it. And it doesn't take a lot of extra calories per day for a person to stop losing weight or even for starting to gain weight. So one of the key educational tips that we give is learn to eat in a mindful way. In other words, when you feel full, try to stop. Okay, so people do not struggle with weight after weight loss surgery because they're eating massive amounts of food. They cannot do that anymore. They cannot have a normal Thanksgiving dinner. They cannot go to a country buffet place and eat a lot of food. They can't do that. But what they can do is they can introduce small extra amount of food with each meal, right? That could get them in trouble. So eating in a mindful way, knowing when you're full is very important. Another important concept that we introduce is people need to plan what they're going to eat the next day. It's important to know, just like you plan your day ahead of time, knowing I have this appointment, I have this engagement, I have this thing that I have to accomplish. So in that same fashion, know what you're going to have for breakfast, for lunch, and for dinner. Have it planned so it doesn't become an off-the-cuff decision where you're hungry suddenly and you're looking for food and the only thing available may not be something healthy. So those are very important things, right?
So if I heard you correctly on the eating too frequently, small amounts, so they can still get a lot of calories.
Absolutely.
Right.
Absolutely.
So,
absolutely.
But because with the sleeve, we are removing a big part of the stomach, and that actually part that is the one that's sending signals to the brain saying that I'm still hungry. That urge will be less. Totally.
So the question is, again, about being mindful. So we can talk about another topic here, what is physical hunger and what is an emotional urge to eat, right? These are two different things. So physical hunger generally is something that builds up gradually. It's coming, right? Whereas an emotional urge to eat is something sudden. It's something that is triggered by an emotional event. And we look for food to try to make us feel better. And recognizing this is very important. So you're upset about something, you're struggling emotionally, try to make sure that your reaction is not to reach for something sweet to eat. Maybe you go for a walk. Maybe you talk to somebody. Maybe you do a lot of meditation. This is important. And it's very important because, Kemal, when I look over the last 20 years, all those patients on whom I have operated, the ones that come back to me, even years and years later, saying, I have started gaining weight, invariably, there is an event in their life that has triggered emotional stress. It could be divorce, it could be loss in the family, it could be loss of a job, something like that, that had got them to go back to revert to finding comfort food as a way out of that. Unfortunately, that by itself can be a problem because you just need time. If day after day you start eating an extra 100 calories, Kemal, 1 year later you could be 10, 12 pounds higher. Okay, and you just need 5 years and you will be suddenly 60 pounds higher to where you were when you lost weight adequately. So the danger for weight gain is there if we are not careful. Now, a very important thing that we have to make sure our patients understand is how critically important follow-up is, right? If a patient has surgery and then they don't come back with us, then this reinforcement about these behaviors, this focused attention on where the dangers are is not going to be there. So follow up with your nutritionist, follow up with your surgeon is important, as well as support group. At CHRIAS, we have a support group the first Tuesday of every month, which is a virtual support group, so the Facebook. And I encourage our patients actually to participate in that because it will be a reminder to them that there are others also who struggle like them, but they will be able to exchange tips on how to overcome that.
So Dr. Irgau, one thing that I want to kind of just go back to, because I'm trying to listen to these, like you and I, we've been doing this for so long, and I'm trying to kind of listen to you if I didn't know you at all. I'm just looking at it from the patient perspective, and or anyone who may be listening to this. So if I'm doing all those, like the question that comes to people's mind, if I'm able to do all those, like why can I just lose weight and then I wouldn't need the surgery, but that's the part that we need to kind of clear. So if these people were able to get to that point and then do like from where they are with the BMI 45, 50, starting those habits, learning those, and then losing that weight is not going to happen. It doesn't happen. So I'm just making sure that our
absolutely
understand that because I can hear someone saying that, well, if I'm doing all those, like why can I just go through this and then not to have the surgery? That's not it. So for anyone to get to the point of if let's say someone is 350 pounds and now for that person to be motivated and stay motivated and get the help of the physical hunger problem too, because the surgery is going to impact those in a positive way. It's going to impact. So once we have that big jump start, then that's the maintaining part is going to go to the maybe normal level. That's why we're actually emphasizing that.
Absolutely. So what the surgery does, it breaks that cycle that is triggered when we try to lose weight by dieting. When we try to lose weight by dieting, our body becomes super efficient and it pretends as if we don't have any extra energy. It treats us as if we are at our tiniest and teeniest in terms of weight, right? And we become very, very hungry, right? Physically hungry. Right? So not only we're not able to lose substantial amount of weight, when we start that diet, the weight loss goes to a certain level and then it stops as if there is a rock stopping it, right? Yes. Not only that, but it triggers all sorts of mechanisms to get us to seek food continuously. So we become very hungry. We're seeking food all the time. That's why the diets don't work. So the surgery can break this cycle. Right? If you think about it at its very basic, Kemal, hunger is a way for our body to look for energy, right? Because food is energy, right? And yet, when you think about it, fat that is stored in our body is energy. So if we looked at this in a simple, commonsensical way, we would say a body that has extra storage of energy would not be seeking food. And yet our biology was built to do precisely that, because we have evolved at a time where food availability was a major issue, right? So our body decided that the best way for us to survive is to be seeking food even when we have extra storage of energy, right? To store as much energy as possible, meaning that it becomes very easy for us to gain weight and very difficult for us to lose weight. It was a survival mechanism. And anybody knows that, right? You have people who start dieting, right? 2 months later, they have done great. They've lost 10, 12, 15 pounds. Guess what? They go on a trip maybe over a weekend and they start eating normally and they gain 8 pounds over that weekend. So it took them almost 2 months to lose 12 pounds and it takes them 1 weekend to get in 8 pounds. Why is the body doing that? Because our body was built that way. That's why we're struggling with weight. Now, when we do surgery, Kemal, we break that cycle. We make our body think as if it has a lot of storage and it utilizes that and we are less hungry. Having said that, as I was saying earlier on, because of a number of reasons, we can look for food as something that comforts us, that makes us feel better. So if we are emotionally stressed and we feel food is the good thing for us, we can revert to that situation. And it's not a question of going out and eating a 3-course meal. Once we've had bariatric surgery, we cannot do that. But what if in the hallway of our workplace, there is a cup full of M&Ms, right? I've had a sleep, you know, I see them, my door is open.
What is M&M?
What's that?
What is M&M?
M&Ms have the little colored candies.
I was pretending I didn't know.
Well, for a minute I thought you were really didn't know that. Okay, but I bring the example of M&Ms to show how little the unit of energy is, right? And it will go in very easily. And I go back and forth, right? And I do that, right? Now, suddenly, I have provided my body a way to accumulate more energy and for the weight to come back. So all those trigger mechanisms that could get us in trouble are there. Now, if you didn't have bariatric surgery, you can regain the weight very easily by eating a lot at once, but you cannot do that when you've had bariatric surgery. So you still have protection. More importantly, when you decide to go back to basics, you go back to you see your surgeon, you go back to your support group, you see your nutritionist, and now you know that you have to get back to the basics. You still have the tool, and you can utilize the tool.
Mm-hmm.
Right? So
now, during this emotional urge, Dr. Erkan, is the stomach acting differently, or is it coming from our brain? What's really happening that's actually triggering the hunger?
So it has to come from our brain, Kemal, and it may not be hunger in a physical sense, but it is an urge to make us feel better because the emotions that you were going through are unpleasant. That unpleasant emotion is just taking over, and we want to feel good. We want to feel better, and reaching for something that will give us that pleasure, whether because it tastes good or because it fills up the stomach or whatnot, is a natural urge. Now, how do you differentiate that? Well, that can become complicated, but there are ways to give yourself a clue. As I said, physical hunger is something that comes very gradually, right? This emotional urges are sudden and they are related to triggers, and recognizing that is a good idea, and try to have mechanisms to deal with that. And also do some other practical things. Don't have those, easy, pleasing foods around you too much, right? I mean, don't have the M&Ms on your desk. Don't have M&Ms in your view, right? So stay away from them. Maybe it's just once that little moment of urge passes, you may be able to overcome that. So all those things are obviously very important. Now, the other important portion of all the weight maintenance that we have to talk about is physical activity, of course, right, Kemal? And physical activity does not mean you have to go to the gym, every day and kill yourself in the gym. Well, if you can do that, bless your heart, that's very good. But for the vast majority of us, that's not a practical thing, right? So we have to develop a way for us to be active, right? Moving. Moving is the key word here, because every time we are moving, we are not sedentary. So the trade-off is critically important. And as I tell patients very often, walking is the foundation of all movement, right? As creatures, as humans, we are made to walk, right? And when we walk, we move all the muscles in our body, right? And what I tell patients very often,
so we need to record that so then we
absolutely,
can
absolutely.
I borrow this idea of simple exercises in our session, and I do talk about those. But I think how simple it is, right, for us to be able to just get up and then just walk around the neighborhood. Doesn't have to be 5 miles, 3 miles, even if it's 2 blocks that you are walking and then coming back. That's free, it's simple, and it's also what we need.
Absolutely, because you see, it's you as a person who's walking. So if you are not walking, it means you're sedentary, right? So that's the trade-off. So every time you walk, not only you're adding movement to your body, but you are decreasing the times in which you are sedentary. Walking is not something that you can ask somebody to do for you. You have to do it yourself, right? So every time you're doing it, it means you're not lying down. It means you're not sitting down. So that trade-off is critical. And now technology helps us greatly. We can track our movement, right? Whether it's a smartwatch or a smartphone, if it is on our physical body, it means we're able to track and we can see how many steps we've walked. And once we do that kind of tracking, then we can tweak our daily routine to add more steps, right? If in the past your most important task was to find the parking spot that is closest to the store or to the office, now your task would be to find the one which is the furthest, so you can add more steps. If you go into a store and you know which aisle is the product that you want to buy, in the past you would look for the shortcut to get there. Now you look for the longest route to get there, provided you have the time to do that. But those are the mindsets that we have to have in order for us to change from a sedentary to a movement-based life, so that lying down would be something that we do only when we are asleep, when we are resting, and of course, when we are working and we need to sit down. So that mindset is very important. And of course, if people can go to the gym and also add strength exercises, this is very important. So the activity, the movement is not only good because of the maintenance of the weight loss, but it is important to maintain your muscle mass. It's important to maintain the integrity of the bone, but it's also good for your mind. It's good for your emotion as well. So movement is very important. And this is a message that is critically important at the beginning of our consultation, because it's possible that either Denise, Patrick, or Karen may have some problems with their joint, with their back, and they've seen their friends or other people go to the gym, but they've not gone to the gym because they feel they cannot work out because they have knee pain, back pain, right? And we're saying to them, workout is not only limited to going to the gym. Making those short steps, even for a few minutes, but frequent intervals, is adding movements to your life. And we want them to start that at the beginning, even when they have the first consultation with us. So as they are going through the program, they increase their activity level. And by the time they are recovered from surgery, activity, movement becomes part of their life. Just as brushing their teeth is part of their routine, walking also becomes part of their routine. So these are important concepts that we have to be able to pass on to our patients so they stay healthy in the long term, not just losing weight in the short term.
So just to summarize so far, like modifying our eating habits,
yep.
The frequency of the eating, finding a good way to deal with the emotional stress, which may impact our eating habits, and moderate exercise. Those are core elements of staying, keeping that weight loss. But these are the things that I'm trying to do, and that's what we try to tell people. I don't have morbid obesity, but this is pretty much my life.
Yes.
Now, when my wonderful assistant Anne doesn't provoke me with food, I try to stay out of any of those high calorie foods. But sometimes it's tough. Like when you come to the office, then all of a sudden there are 2 nice plates on your table, on your desk, and then because you're already hungry. So that's the other thing, right? So like this happens because this happens with our family members. This happens with our friends. So the food actually is a pleasing vehicle, I guess, the way that we please. And I think in moderation, there's nothing wrong with it. But when we have patients who are dealing with morbid obesity, Dr. We discussed the same thing with patients with diabetes. So it's not just about that patient trying to do certain things by himself, herself, but it's also their family members trying to support that person so that they can prevent certain things, maybe riskier for diabetes. So morbid obesity is kind of similar. So you don't want to have, you want to have good support around your, you, and then that way, you stay healthier and you can stay more compliant, I guess. But the main thing is what I'm hearing again is the tool. Actually, surgery is the tool to actually get to a certain level, and then maintaining is going to be up to the person, because that tool may not work if there is not enough understanding of what needs to be done for long term.
Absolutely. That's a great summary of the situation, Kemal. So it is very important for people to understand that when we are offering bariatric surgery, we are offering a longer lasting solution for the problem. So we want them to lose weight, and we want them to stay healthy, and we want them to stay healthy for the rest of their life. So providing the surgery is a very important step in that respect, but providing the information as well as the support system for them to succeed in the long term is important. That's why we consider patients in our practice as patients for life, because we want to continue to see them for the rest of their life, to be there to support them, and to provide them also with the tools that they need in terms of information, but also encounters with nutrition, right? But also the support groups, right? Kemal, the support group is very important. As I said, the CHRIAS American Surgery Center and also St. Francis Hospital program, the support group meets the first Tuesday
of every month.
And I encourage all patients to participate in that, because support groups are a way for you to really reinvigorate yourself, to get back to the basics, to restart again when you feel that you're going backwards.
Absolutely. All right, Dr. Erkan, anything else you would like to add? I think
absolutely. We've said many things today, Kemal. I hope people find them useful, and I encourage people who've been watching to pass it on to other people as well, particularly people who are struggling silently with morbid obesity, because there's no reason in this day and age for them to do so. There is treatment available, very safe, effective treatment that can be provided.
Being in a program that actually is specialized in bariatric, having all the expertise that helps our patients a lot, and that's why we are here for. So we want to help more people, and thank you for being with us, and we'll see you next week at 3 p.m. on Friday again.